NHS intensive care doctors have told Good Morning Britain that they are exhausted and breaking under the pressure of rising COVID cases. The Prime Minister is calling for maximum vigilance and says lockdown restrictions will be tightened if necessary.
Jonathan Swain is at New Cross Hospital in Wolverhampton, where they now have more COVID patients than back in the spring. That's almost 300 in total. Jonathan, it just seems to get worse and worse. What are staff there telling you?
Good morning, Susanna. Morning to you, Piers. Anybody watching this who thinks of breaking the rules, thinks that COVID doesn't apply to them, they should come and stand here, because let me show you what a pandemic looks like. Through here is an intensive care ward. We're filming through the glass. It's safe what we're doing. But lying in beds there are grandparents, mothers and fathers who are literally fighting for their lives. This ward here in intensive care is almost full, and this area of the West Midlands has one of the highest infection rates in the country. So in a few weeks' time, more people will be suffering with COVID and more intensive care beds will be needed. I should just point out, NHS England, the hospital, have invited us here today to show you the reality of what COVID is doing now, not just here, but in hospitals around the country. These people are now in induced comas. It is grim, I admit that, but the machines there are keeping them alive. They have ventilation machines there, the staff are working on. They have to give the patients medication to sedate them so they can actually tolerate the ventilator. Many people have kidney failure as well, so they need support for that and drugs to monitor and to stabilise their blood pressure. It is grim, but it is reality, and this is what NHS England wanted to show our viewers this morning. So if you think about going to the park, sharing a coffee with a friend, perhaps just tweaking the rules, don't. Let me tell you, you do not want to end up in here. Let's have a chat to Dr. Brian McCaig this morning. Thank you for inviting us in.
Pleasure. Good morning.
It's shocking for me to see this, the first time I've seen it. Give us a sense of just how things are now for you.
Well, as you can see yourself, it is exceptionally busy. We are very used to looking after ill and sick patients. However, from our normal capacity, we are being asked to increase, and we absolutely need to increase our capacity in our intensive care to 175 and up to 200%. And we need that to cope with the volume of very, very sick, unwell people that are coming into the hospital. The impact of that is not just on the staff here having to deal with more patients, but we have to recruit staff from other areas of the hospital to come and work in intensive care, to be trained to work in an intensive care environment, to look after this cohort of patients, which is significant. That has huge impacts on other services. We've had to make very difficult decisions about cancelling operations, impacting on patients waiting for surgery, and patients waiting for cancer surgery. So some really, really difficult decisions to make for these patients.
And Brian, just finally, when you hear people breaking the rules, how do you feel about that, having worked in it?
Well, I think we're all in this together. We know how difficult it is for people to comply. We know the pressures people are under, and we absolutely get that. But I think when we look at dealing with COVID, we look at everybody dealing with it. We've got our job to do in the hospitals, but people in the community can do their job. Every time you meet somebody else, there is a chance that you may contract or pass on the virus. If you can stop doing that, that would be exceptionally helpful.
Brian, for now, thanks so much for inviting us in. Good luck to you and the rest of the team here. And let me just tell you, Piers and Susanna, this is just what we're seeing here is just one hospital. This is replicated in towns and cities, isn't it, around the country. And lying in these beds, gasping for breath, are mothers, fathers, family members, not knowing whether, of course, it'll be their last breath.
Yeah, very sobering reminder of what is going on inside our hospitals. I think there are two worlds right now. There's inside these hospitals and there's outside. And inside, there are more people than there were in the first wave, fighting for their lives, many of them sadly losing their lives. And of course, the cruelest thing, Jonathan, is how empty it all feels. No relatives. Yeah. You know, the sort of clinical element of this, the cruel element of coronavirus, where you just have the patients and you have these brilliant NHS heroes trying to save them, but nobody else. It's like this little lonely battle going on, isn't it, with no relatives allowed anywhere near these wards.
That's right, Piers, and sadly, the staff here have had to cope with that as well. Not only are they caring for the patients 24/7, but many patients come here, not all of them leave here walking or are well. They've had a number of deaths here recently as well, and the staff have got to know the patients and cared for them. They are the only contact or family that they've kind of almost had in this very surreal world we find ourselves in this morning. As you say, there are two worlds at the moment, the walks in the park, the coffees, the queues at the supermarkets. And then you come here, and let me tell you, it's going to change, or it should certainly change people's behaviour after seeing what we've seen this morning.
Yeah, and I just think, once again, let's just take a moment to pay tribute to all the NHS staff and people working in care homes. But the NHS staff now, they've had nearly a year of this, of hellish conditions.
Exhausted.
12, 14-hour shifts, some working 7 days a week without
and
a break.
losing so many people, of
Losing
course.
their own colleagues who've been dying on the front line through a lack of proper PPE, knowing that and going back in to risk their own lives on meagre salaries in most cases. And they, you know, a lot of their colleagues are self-isolating or get the virus and can't work, which means they have to work even harder. They're exhausted at the end of their tether. And yet, look, there they are at 8:20 in the morning, doing everything in their power to save the lives of complete strangers. And it's an amazing thing that they do. And we're very rarely allowed the access to watch these heroes in action. And I think we should see more of it. We should remind people what is actually happening in these ICUs at the moment, because they're at breaking point. It may not look like it, but everyone in that unit, every patient is fighting for their life. And they're reliant on those people to save them. And those people are exhausted. And everything that we can all do to help would be, I'm sure, hugely appreciated by them. So thank you, Swain. Great, a very powerful report. We need to see more of this. We need to get inside these hospitals and show people the reality of what is going on.